in the middle of March of 2020 is when we started to realize the impact of COVID-19.
And with COVID, everything changed because it's something that we never expected. We never thought that we would ever have to handle such a situation. I mean, we've heard there could be a pandemic, there's such a thing, but when the reality hit, we took it like a punch in the face. It came on quickly, came on from nowhere.
We usually have parties here every week, but because of the pandemic, we have to be very careful with the group activities, the social program.
You know, we could do bingo and we could do cooking classes, and the pastor would come out and they would read from the scriptures. We could do exercise classes, and it basically became that our entire activities department had to be inside the room.
We're doing birthday parties on the go. We did our Taco Tuesday on the road, so we deliver burritos every Tuesday to the residents. So we continue our cooking classes with limitations. You know, we try not doing so much of a switch on them because it is a hard time. Now they can't see their family. Now they have to stay in the room. They can't be around their friends. So we try being there as much as we can.
All of us nurses, all the staff actually, all our jobs became not just a nurse, we became family member. We became their brothers, we became their sisters, we became their confidant. Everything has changed.
When the morale of the staff is low, the residents can feel it. They're the first ones that feel it. When the morale of the residents are low, the staff is the first one that feels it because we're family, we're here. They work with each other every single day. As much as we, the staff, try to be positive with each resident and be there for them and be their family, there is nothing like real family. So that's something that had a real negative effect on residents everywhere and brought down the morale within our residents.
There was a lot of fear and anxiety within the residents of the facility because of what they were seeing on the news and the media as far as skilled nursing facilities, long-term care facilities being impacted greatly with outbreaks.
We realized that if this is going to be the new norm, at least for now, we're going to have to come up with something to be able to do with our residents, activity-wise and visiting-wise.
When we had to shut down all of visitation, we went to FaceTime, we went to cell phones, we went to Zoom meetings, all of which kind of helped, but it's still not the same.
We came to the conclusion we're going to think out of the box and I guess figure out a way to come up with some visiting box.
So we started talking with the residents that this was going to be an opportunity, and so there was a lot of hype, I guess you might say. They were very excited.
To be able to visit with your people, to be able to see them face to face, my goodness. You can only go so far on a telephone call or on your internet. You know, there's your person in the flesh, the person that you love, the person that you hold.
We have a waiting list actually for people that want to use the visitation center because we schedule it. It's the only way to be able to manage it effectively with everybody that wants to utilize it because we clean it before each use, we clean it after each use. We have a staff member present with the resident when they are visiting with the family member. We do require that the families, when they do come to visit, that they do continue to wear masks. We've seen tremendous appreciation by the families and the residents to be able to actually see their families again.
Nobody petitioned for that. They took it upon themselves to do that. They were proactive in making sure that they were getting the patients with their families as best they could.
We have a strong family organization for the residents of this facility. Typically, before COVID-19 times, we would probably have about 15 to 30 family members here every day. And that's a lot for a skilled nursing facility. And then to be able to, not be able to, but to have to tell them that they're not going to be able to do that anymore was challenging for the visitor, or for the residents and for the family members. So having the visitation center now has helped that tremendously. And the family and the residents really do appreciate it.
Seeing their family gives them a sense of normalcy, not just having them like seeing us every single day. They get to see a different face or their family member, even though we are their second family. It's so wonderful to see them. Sometimes they come in a bunch, like sisters, brothers, grandkids, everybody's here. You know, it's wonderful to see. It gives you hope in the future that we're gonna be able to become normal again, not just having them visit here, but for them to be able to hug their family, their grandkids again.
To me, it was very important that we got that guidance right away in the beginning, saying, hey, this is going to be long term, but we're going to make it through, and we're going to do what we can to be the best facility for our staff, the best facility for our residents.